Afternoon or good morning, everyone, depending on where you are in the world. This Friday, July 9th, we are thrilled to be back with you after a week hiatus for the holiday here in the United States. And we've just wound down our International Executive Board meeting. Some of us, it seems, are having quite a bit of difficulty with our internet connections today, so we apologize in advance if there are hiccups with that here on Zoom or on Facebook Live. We are thrilled today to again be with you all and to continue sharing the way that IPM is responding to the ongoing COVID pandemic, particularly the second wave that many of us in the United States are just becoming aware of now, the Delta variant and other variants that have been wreaking real havoc and causing enormous suffering throughout the world. Over the course of the past couple of months, we've seen our emotions ebb and flow as in many parts of the world, vaccines have been able to stem the spread, and yet in others, as we've heard from Brazil and Colombia, India, Nepal, and Kenya in particular, this second wave in many ways has proven to be more virulent and more difficult to handle even than what we've experienced throughout the past year. We're really honored at this time to be joined by a number of members of the wider IPM family in South Asia, particularly in India. The death toll, as many of you know, has already reached 4 million as the growing disparity in vaccine access leaves poorer nations exposed to outbreaks of more infectious strains or variants as they're known. And while many of us in the United States, I know in my recent experience traveling to the IPM headquarters in Cleveland, folks are sort of getting about with their lives and almost forgetting. It feels like it's sort of after the roaring 20s and people are enjoying the freedom and being out and about again. The rest of the world, and particularly the so-called developing world, is shouldering a continued devastating rising death toll. India accounted alone for 26% of the increases from 3 to 4 million deaths over the past few months. In Brazil, about 18%. So two countries, if you can do that simple math, two countries where IPM has a long and active presence right now are 44% of the new cases worldwide. The US, of course, where more than 330 million shots have already been administered, is only at 4%. And that leads to this growing gap and real growing, not only disparity, but lack of understanding of what might be facing the US again this autumn if the variant does get to the United States, as we were seeing in Ohio last week, in numbers that are quite concerning over the coming months, and certainly as the weather in the Northern Hemisphere begins to cool again. This, as always, is an interactive conversation. We look forward to hearing from Mahesh and Hemant, Parveen, and others about the challenges that they are facing and their remarkable selfless work amongst our Indian partners and friends. And we know that they have been taking great personal risk to provide the emergency relief so desperately needed by the communities where IPM works. Many of us, I know I speak for my colleagues at IPM in the United States, in some ways are feeling quite helpless in the sense that there's little that we can do at this point other than to offer our solidarity, our financial and material support, and our prayers, of course, as they continue, our South Asian staff in particular, to take the lead in the response locally to the pandemic. So as I turn it over to Mahesh and Vindhya, Parveen, Hemant, and others, I want to thank them publicly for their remarkable work and the way that they continue to inspire the IPM family in the ways, the myriad ways they're responding at these unprecedented times. As always, we'd ask you to mute yourself if you're not being part of the conversation. You can chat your question into the Zoom chat function or on live at Facebook, and we'll be sure to share it with our presenters at the appropriate moment during today's virtual forum. So thank you again, everyone, for joining us. Thank you particularly, Mahesh, for preparing this presentation with our Indian colleagues and friends. And I'll turn it over to all of you at this time.
Thank you, Joe. Vindhya, may I request you to start the presentation?
Thank you, Maheshbhai and Joe. Good morning and good evening to everyone. My name is Vindhya Vatwana, and today I'm going to share the effects of COVID-19 second wave in South Asia and how we responded to it. Next slide, please. So before I start, I would like to request Maheshbhai to explain the next few slides.
Yeah, so I think I'll just give an overview of IPM's interventions in India and Nepal in the year 2021. Last year in 2020, the lockdown saw large-scale problems of migrants trying to reach home, and that was one of the major tragedies that most of Indian workers, migrant workers and the poor faced in our country. There are also heartbreaking stories of those who made it home and those who did not make it home, who died on the way. The second major crisis that we faced last year was that of a hunger crisis, with many barely having a meal a day, and many of them having lost their lifetime savings trying to provide for meals and for taking care of their immediate family and children and adults and the old. Unlike last year, 2021 has seen devastation of another kind. And I think both nature and government both are equally to blame for the situation that we were in. And the lack of medical facilities, in particular oxygen, was an issue. There was a tsunami of COVID cases and deaths, which have been well covered by the international media, and I wouldn't like to go too much more into that, but speak more about the responses that we have had in our country. For every reported case, more than 15 to 25 cases have gone unreported. And this is not only based on the data that international organizations have provided, but our own local data that we have been able to analyze, scientific data obtained from well-reputed institutes. Partner interventions in this space would be broadly covered into 3 or 4 major areas, and this would not have been possible without the gracious support of IPM family and friends. And broadly, it included the following. Given the massive crisis at the hospital levels and lack of oxygen and concentrators in urban centers and facilities in rural areas, we as a team, we all got together and decided that we will follow a strategy of prevention, early diagnosis for symptoms, and conduct educational campaigns to the extent possible. However, each fellow had a customized strategy based on the local scenarios. So just to give you an example, Sharadat Ali, who's based in Jaipur and works mostly with children, he focused on nutrition in children and educating them on diagnostic practices, keeping in mind that in the near future, children are going to be the most vulnerable in terms of COVID infections and deaths, because they are the ones who are going to get the vaccinations the last. Parveen Sheikh, who's based in Ahmedabad, she also focused on medical relief and assistance and food relief to children and dealing with the unemployment crisis. She is from an urban center, and the urban centers saw their worst in last year, and they saw a more difficult situation this year too in terms of the numbers of their senior fellow Himmat Bhai Chauhan. He's put the strength of his whole organizational team in reaching out to the community and to reaching out to far and distant, far-flung villages. People had neither access to healthcare or even access to medical facilities, doctors, and everything that urban centers have access to. He was ably supported by his team, by Vindhya Makwana in particular, and in assisting the women and the elderly, often coaxing them, cajoling them, and counseling them. And I must also share that many of them have had personal tragedies in their families. And in spite of all that, they have focused on this. And this is as much a tribute to their efforts as to the efforts of other organizations who participated in this effort. Just a brief statistical look at COVID, because that's another area people were interested in. India's COVID cases tops 30 million. And this was published on June 23rd. The other data that people have been asking me about is about doctors. So around 730 doctors died of COVID-19 pandemic in second wave. All this in a period of 2.5 months. We are seeing this there. Government's infection fatality rate claims show India had what you call 23 infection missing for every reported COVID case. This is again data of 22nd May 2021. So with the country having reported 3,15,235 deaths till Thursday morning, again, the report is based in May. This would mean that the total infection in the country stand at 63,0470,000 against a total figure of 27,36,993 cases. Out of the three scenarios posted by New York Times, the most likely scenario estimated was 539 million infections, calculated at 20 cases missed for one tested positive. Our data shows that it's 23 infections missed for every reported case. But while the denominator goes from 15 to 20 for missed cases, for the infection fatality rate, it doubles from 0.15 to 0.30%. Deaths then become 1.6 million or more than 5 times that is officially stated. This is a combination of various things. This is of misunderstanding, of people not knowing what has happened. I know at least 3 deaths that have taken place due to COVID have been declared as deaths due to heart attacks, death due to fever, and various other things. 2 more just statistical information that I'll provide, and then I'll hand it over to the team which really did all the hard work on the ground. COVID Facts India, the number of people who are poor in India, and I'm referring to people who earn less than $2 a day, it is estimated to have increased by 75 million because of the COVID-19 recession. And I want to point out here that this accounts for nearly 60% of the global increase in poverty. So what happens in India does impact globally in terms of the spread of the disease, in terms of the consequences of the disease, in terms of poverty and unemployment. The middle class in India has also shrunk by 32 million as a consequence of the downturn. This again accounts for 60% of the global retreat of people in the middle income tier. Again, I'm talking about the global retreat of people. So you can imagine the scale and extent to which COVID has impacted our country. So Bindya, I think that broadly covers what I have to share here.
Thank you, Mayush bhai. Now I would like to invite Somi ji to share their experience during the COVID second wave. Somi ji, please.
Thank you,
I would like to
Bindya.
hand it over.
Okay, I'm sharing some cases and some situation of Nepal, and this is the data of 7 July 2021. We have a total day, and day-wise we can get the data of total people test PCR done is 11,988, and that day the recovery cases was 1,333, and the positive cases was 2,979. The 7th July, that dead cases was 28, and a little bit down the slide.
Yeah, it doesn't move actually then, but it's basically, I think, let me see if I can reduce
Yes,
this. Are you able to see it now? Okay.
Now it's fine.
Oh, okay. Is this better?
Yes, now, thank you, Mayush bhai. And this is according to the data is made till from the beginning, when the COVID started till now, the positive cases according to the age, the highest in age is 31 to 50 is the highest cases found, and the lowest number found between the age 71 to 80, and dead cases highest found in age 60 to above 60, age of the above 65, and the lowest found in age of the age 10 years and to 19 years. And in Nepal, we have a total vaccine received, first dose vaccine received by the people of 26,11,807, and second dose got the 8,51,300. Next one. And we have some work done in Bandipur, Atumka villages, and Fulmati, and our friends supported some, because of COVID, some people lost their jobs, and we help them some food. This is the you can see the bag with rice, salt, and some lentil dal with packet. We have support them. We make the group, and who are really needed, we support them. And next one, that before 2 months, that was the high peak level of the COVID cases. So there was a shortage of oxygen cylinder. COVID cases are also high, and hospital, they don't have stock. So this is in Bandipur, the hotel committee is, they donated this cylinder to Bandipur hospital, because some people die because of they don't get oxygen in time.
Okay, so
Next
you're
one.
on the microphone, you're on the camera. And
This is Pulmati and women group against the domestic violence campaign in the midst of the pandemic.
Normally do.
There's some domestic violence also happens in the between the COVID, that lockdown period, and this 2 years pandemic time. And this is they are against for the handling this for against the domestic violence. Next one. Thank you. And I'll pass to Praveen.
Thank you, Sonuji. Now I would like to invite Parveen to share their work. Parveen ji, अभी आप
ओके हेलो, मैं परवीन।
हाँ,
हम जो है वो 4 एरिया में काम करता है, दानी लिमड़ा, वटवा, बॉम्बे होटल और चंडूला लेक। ये चारों एरिया में फूड किट दी है, जो 50 किट्स थी, जिसके अंदर राइस और आटा, ये सब था, खाने का जितना भी राशन है वो सब था। और वो भी जो सिंगल वीमेन और विडो वीमेन है उनको क्वालिफाइड करके दी है। दूसरा कंटिन्यू चल रहा है हेल्थ का काम, जो 3 महीने पहले हम लोगों ने शुरू किया था, वो अभी चल रहा है ये जो 4 एरिया है उसके अंदर। और तीसरा था कि हमारी जो लड़कियों ने मास्क बनाई थी, उसमें से जो पैसा आया था, उसमें से बच्चों को 85 बच्चों को हम लोगों ने बनाना और केला डेली मॉर्निंग 12 दिन तक के बच्चों को दिया था। और अभी कोविड-19 के वजह से जो हेल्थ का प्रोग्राम हम 3 महीने से कर रहे थे, उसमें अभी हाल में हमने 85% लोगों के साथ, मतलब हमको अच्छा रिस्पांस मिला है। अभी 15% लोगों के साथ उनको थोड़ा प्रॉब्लम हो रहा है, जैसे चेकिंग करने के लिए।
परवीन बेन 1 मिनट હું આટલું થોડું સમજાવી દઉં પછી.
Okay.
So she has just shared. She works in 4 major areas of Bombay Hotel, Dani Limda, Chandola Lake, and Vatwa. Their team regularly carries out the following 4 tests: temperature, blood sugar, blood pressure, and oxygen test with oximeters. Apart from this, they have provided food relief as unemployment is at an all-time high in urban centers the past few months. 50 food packets were provided, and as she shared, that were provided to the widows and single women who have nobody to earn for their families. From the money they made in making and selling masks, they provided children eggs and bananas to supplement their nutrition. She just mentioned that they have been successfully able to do the health checkups with 85% of the people in their areas. 15% with them they are still struggling. हाँ परवीन, आप अभी बता सकते हैं।
हाँ, जैसे एरिया में हम जाते हैं और लोगों को पहली बार जब हम लोग गए और लोगों को चेकिंग करने में आता था, जब बहुत दिक्कत हुई और प्रॉब्लम हुई, वो लोग समझते थे कि हम वैक्सीन के लिए आए, क्योंकि मेंटेलिटी ऐसी हो गई है कि वैक्सीन लगाने से लोग मर जाते हैं, ऐसा है वैसा है। जैसे कि सब स्थानांतर लोग रहते हैं ना एरिया के अंदर, तो उनको इतनी ज्यादा माहिती है नहीं कि भाई ये चीज अगर हम वो जो ऑक्सीजन का मशीन यूज करते तो वो समझते हैं कि हमको ऑक्सीजन की कमी होगी तो दवाखाने ले जाएंगे, या फिर हम लोग रजिस्ट्रेशन में लिखते हैं उनके नाम, या भाई हाई बीपी कितनी है, ब्लड प्रेशर कितना है, तो उन लोगों को कुछ अलग लगता है कि ये लोग कुछ डेटा कलेक्ट कर रहे हैं। तो हेल्थ के लिए बहुत पहले पहले तो बहुत प्रॉब्लम हुआ, बाकी अभी थोड़ा सही है उसके अंदर।
Okay. Ji. So in the beginning, it was difficult to convince the people for health checkups, as most of them are migrant workers. So they were thinking that when they are checking the oxygen level and temperature, they are doing the COVID test or the vaccination registration. So they were afraid, but right now they have made up to convince them for the health checkups. जी परवीन, आप बता सकते हैं क्या?
बस मैं ना बिंदिया बेन, और बस यही है अभी तो।
ठीक है।
परवीन मैंने आपको इसके बारे में कुछ बताना है? अभी राशन की जो आपने डिस्ट्रीब्यूट की थी ना, उसके बारे में कुछ अगर बताना है आपको तो।
बस ये जो हम लोगों ने राशन किट चारों एरिया में मिला के 15 दिए है, उसके अंदर जो मैच्योर मतलब मैच्योरिटी लग रही थी जिसके अंदर के भाई ये बहुत नीडी है, जैसे कि सिंगल वीमेन और विडो वीमेन्स, इन लोगों को ही दी है। और इसके अंदर पूरा राशन कुछ 20 दिन का राशन था, वो सब मिला के पूरा घर का राशन होता है वो दिया है। तो हेल्पफुल रहा है उन लोगों को, क्योंकि अभी वैसे भी सब लोगों का जो वीमेन सिंगल थी वो काम करने जा रही थी, काम सबका बंद था, तो उनको उस टाइम पे बहुत जरूरत थी राशन किट की, और उसी टाइम पे हमने एग्जैक्ट टाइम पे उनको दिया है, तो उनको बहुत हेल्प रही है।
Okay. So she just said that they have given the ration kits to the poor and needy people. Here there is a list of things which contained in the kit. I would like to mention the things here. It contained 10 kg of rice, 10 kg flour, 2 kg cooking oil, 1 kg sugar, 500 gram of lentils, 250 gram of red lentils, 250 gram of moong dal, 1 kg salt, 100 gram coriander powder, 250 gram chili powder, and 100 gram of turmeric powder. This is almost a ration or required amount for a family for almost 20 days. Next slide, please. Okay, Mahesh bhai, I would like to ask you to explain about Shahadat ji's work.
Yeah, sure. So here you see, unfortunately, he has not been able to join us, but these are some of the photographs that Shahadat has shared with us. Shahadat is actually a civil liberties activist, and he works on human rights issues in a range of slums. There are around 27 slum settlements in the city of Jaipur. But his heart is always with the children in that area, and every morning from 8 in the morning to 1 in the afternoon, usually you'll find him spending time with children, teaching them on a regular basis. So he's got 4 centers, and they cover around 100 children. So he decided to focus on the young children who are without food. As you can see, they are some of the poorest of the poor in that area. And he realized that giving them some nutritious food over a period of time would help them better to build up their resistance than actually carrying out diagnostic tests with children. And so even though his first few days he spent on teaching them how to measure, all the kids, leaders in that area, young leaders in that area, know how to carry out oximeter tests, blood sugar, blood pressure, and temperature tests. But then he started focusing on their food needs. So here you see a few photographs of him working with his children. They decided on boiled eggs because it's one of the easily accessible items in the market, easy to transport, easy to boil them at home and carry them around with you. And he actually has a bag, and he and his friends, they go on motorbikes and go to these 4 centers and distribute the eggs in that area. And just to give you an idea, we finally worked out a price, and you get around 12 eggs $1. So that's quite a decent price. And one boiled egg actually goes a long way. I think there's a saying which says an apple a day keeps the doctor away, but an egg a day actually keeps you pretty fit and takes care of certain basic nutritional needs. So on every Monday, usually he gives eggs. Every Wednesday, so he shares it with them thrice a day. Every Wednesday, he shares bananas with them. Again, ripe bananas or overripe bananas are actually very nutritious, and you get it at a discounted price in the market because the middle class and the rich don't like bananas which are stained or black in color. But as most of us know, it is higher in iron content and also has it immediately takes care of your sugar needs in the body and carbohydrate needs. So bananas are the other thing that they share on Wednesdays. Every Friday, they have a sandwich, which you can see in the slide on the left of the screen. So they have usually brown bread, and they have either peanut butter or regular homemade butter that they get from people. They also introduce vegetables in it. Most of the children rarely eat vegetables, especially green vegetables. Leafy vegetables is something that they never get. So you have tomatoes, you have cucumbers, you have leafy vegetables, which are part of the tomatoes, which become part of the diet. And that becomes very often the major meal of the day. So that was the next slide. And yeah, I think, Vindhya, I hand it over to you again to share the work that you all have been doing.
So we had received the diagnostic kits at Pochavai Foundation. Yeah, I would like to mention that it was supported by IPM, and it contained oximeter, blood pressure monitor, blood sugar monitor, infrared contact, non-contact thermometers. And we had distributed the kits. Along with this, we give the mask and sanitizers to 30 villages, which helped later on for us to do the health checkups in all the villages. Next slide, please. Okay, so when we were doing the health checkups, we got a request from Primary Health Center. Primary Health Center is a government authority in India. They asked us to help to motivate people in the villages to go and get vaccinated. So they had given us a written request to do the vaccination campaign. And in the photograph, you can see Bhanubai, Taraben, and Madhuben, who are explaining the people around, especially the women and elders, to go and get vaccinated from the primary health center. Just beside the photograph, you can see a news article where a leading newspaper has taken note of how we were doing the health checkups in the area. In the newspaper cutting, you can see Madhuben doing a health checkup of an elder lady. And I would also like to mention that I was also doing the health checkup with the whole team. We have the teachers in all 30 villages, and they were doing checkups. So personally, when I started going for the checkups first, we used to get that comment that are you going to give the reports like temperature or oxygen to the government authority or the hospitals, and they will take us to the hospital by force. And there was a fear also, but later on how we continued doing it for a month, then it became easier for them. And nowadays it's becoming reverse. Now they come to the teachers or volunteers of us, and they ask for the health checkups, whether they have to get blood pressure checked, or they want to check their temperature also. Next slide, please. Okay. So before giving the health checkup kit to all the volunteers and teachers, we had decided that our team members will go to each of the village and explain the volunteers how to use it. Because if sometimes if you don't explain how to use it, it becomes difficult to achieve the motive which we want to. So in the picture, you can see Navneet Bhai and Bhanubai explaining how to use the thermometer, blood pressure monitor, and blood sugar monitor. And people were also present there, so they could do the live demo for the teacher and the people also, that it's safe to get it checked there. Next slide, please. Okay. So then all of us started doing the checkups. In the picture, you can see that I was checking the oxygen level of a woman in my own village. Next slide. Okay. Here also you can see Megha and Bhanubai doing the checkups of the elder people. I've also, there are some friends of mine who also do the checkup. I would like to share one more experience. Uh, Tara Ben is there in my team, and she had shared that earlier when she used to go for the checkups, people were also asking for the thing that if you are checking our blood pressure and it's abnormal, whether it is high or low, are you going to give us the medicine? And we didn't have a option like how to reply to that, because we cannot give medicine without doctor checkup or proper diagnosis. We can just advise them to go and consult a doctor. uh, I think I have forgotten it, but yesterday when we were having a conversation with Parveen Ben, they had find out a way for this. uh, they got the same issue in their area in Ahmedabad. So Parveen Ben took a help of the corporator of local area, and they arranged a van which had the basic medicines, and it became helpful for the Daniel in the area. Thank you. Next slide, please. Okay. There is a picture of Navagam village, and here they had got a help of a trained nurse. In this difficult times, we came to know that if we really want to do something, we can get help of professional also, because the lady in black dress, she is a trained nurse, and she actually helped our teacher to go and do the checkup, because it was not possible for us to go every day with them. So she went up for almost for a week to train our teacher. Next slide. Okay, so there is again another news article where the news had taken note of what awareness, vaccination awareness campaigns we were doing, and also the health checkups we were doing in this area. Here, I would like to mention one thing, that April and May was a peak time in village area, especially, and in those 2 months there were 69 deaths, and it was a huge number for all of us. Somehow we have survived, but it's still there, and we have to be really careful with it. Uh, okay. Meshbhai, I think that's the last slide, right?
Yes, I think that's the last slide. Yeah, thank you.
Okay. Yeah. I would like to ask Himmat Bhai to add something to this.
I think Bindya is cover all our work we are doing in this pandemic. But this is very important and very useful to the community, because in village area, people, they are not aware for their high BP and their sugar and all that. And suddenly in someday we know that people are die because of their BP is high and is attacked, heart attack. And they are not checking because they went Khambat and Tarapur is a far away, 25 kilometers from his village. So they have, and their doing very hard work. So they don't know about they have a high BP, a low BP, yeah, his sugar is high. But when we started this health checking campaign to help with IPM, and this is very good, and I think this is to save lives to the people, I think. And so I am thanks to IPM to help to buy this equipment, and then we give training to our Bal Mitra, our volunteers to the villages. So we give 30 villages to all kids, and they are doing amazing work in the area. Also, we are started the vaccination drive awareness campaign in our area. So you show that pictures. There is one rickshaw, and we in with their banners. So we meet villagers and we talk with them. We meet women's. They have a fear when they take vaccine, and we have died. So this is in their mind, but still now they are started to take vaccine. So this is also very good for after that campaign. So thanks for India to add.
Thank you, Amit bhai. Mahesh bhai, if you would like to add something to this.
Oh, I think I mean, all of you have done a great job, and and I know people who have never been to the villages there. I know people, it's so hard to work in your own communities. It's so easy to come driving in a car, visit the village and go back home, but to actually live in the villages where more than 60 to 70% of your population is affected by it. Almost every household has, some of you also may remember Shashi, who was a past fellow and who works in Delhi and Bihar. He went back to his hometown. In his village in Bihar, just 100% of the village is affected by COVID. But there are no records that show you that. There are no statistics that reveal the harsh realities. You may also have seen occasionally a news article saying that you found dead bodies in the villages, And since we have had a couple of sessions on caste, I just want to point out that very often Dalits are not cremated. We either bury them, and some of them, and they don't even have land to bury their dead, they actually throw them into the river because they don't have facilities for cremation. Correct me if I'm wrong, Himubai, but isn't that true in many other places? So COVID has had a larger impact on various aspects of those who are underprivileged, So whether it's caste, whether it's women, I know it affects the rich too, it affects the middle class too, but I think the poor bear the brunt at multiple levels. I also want to point out that Himu and Hemat and I, sorry, I keep calling you Himu, which is a term of affection. Hemat and I have been discussing the consequences of some of the COVID support that has emerged. Most of the resources have gone into hospitals, where actually what we need is at the grassroots level. We need more resources at the grassroots level. We need more money for day-to-day events rather than emergencies, because the hospitals anyway are overcrowded, and it's at a very critical phase that you need oxygen concentrators. The second thing that it has impacted a lot in our area, and we keep constantly talking about this, is how it has impacted the life of women and children, their education, for example. The schools are closed, and the poor really can't afford cell phones and things like that to do online education. In some places, the connection is so bad that you have to actually climb a tree to get connection, and to attend a class. So very often you'll find young adults sitting on top of trees because the connection is not there, and this heat is horrible in the humidity and the heat that we have. You're not sitting in a room where there's electricity and there's an air conditioning or there's a fan. You actually have to climb a tree. There are recent articles on that. So children have been affected badly, women have been affected badly. Some of the resources which were meant for local children's education has now been diverted to COVID. So the COVID has become an excuse to divert the resources from various other aspects of our day-to-day living. Whereas actually health is an integrated subject, health is something that you need to take care of nutrition, you need to take care of women's health, you have to take care of women's health in particular. I think we have not had time to share some of the photographs. A lot of the menstrual hygiene work that is going on, menstrual health work that is going on, the COVID awareness work that is going on, the nutritional aspect it's all interlinked. One of the amazing things of the work that they've been doing is that they've suddenly, the whole Pochabhai Foundation's whole team is seen as people with compassion, people who are sitting down with the elderly, for example. I know how difficult it's in the West too, but even in our societies, the elderly are often neglected, So when you hold somebody's hand, when you measure their temperature, when you inquire about their health, there is a whole psychosocial aspect of the work that is going on, which again we have covered. And I think because of barriers of language and a formal presentation like this doesn't allow us to delve deep into those stories. And I think we need to have a series of interviews too, based on the work that is going on. And I think it's as again, this remarkable work is going on, but there are those who write about it and those who do it. And I think the team here is so busy doing what they're doing, and much of it rarely gets covered by the larger media and larger forces operating in our societies. So very often, whenever somebody asks me from the West, how can we help? Should we send oxygen concentrators? I said, no, send us 1,000 oximeters. That makes more sense than sending us oxygen concentrators. Again, a large part of these concentrators and the international aid that has come in, it goes to a lot of non-profits who are not specialized in the health sector. So just imagine a lot of ordinary NGOs collecting a lot of health concentrators and not knowing how to use them. What are the precautions to be taken? How do you deal with water issues, purification issues, sanitization issues with this? There are side effects of fungal infections that have taken place. So I think there are many aspects of this that have not been covered, and I know there is a tone of hopelessness. There is a exhaustion in the team. There's a lot of sadness in the team. So even just to keep ourselves going, to pull our energies back and to serve society is also a very difficult task. Himu's family has suffered. Parveen's extended family has suffered. Vindhya has seen a lot of disease in her immediate surroundings. Many of us have seen our family. But it has been, I think, a combination of resources, it's a combination of care. That's why, we have used the word IPM cares rather than IPM response for this particular effort in our region. Because I think caring and sharing are so important in what we do. And that somehow sort of, the word captures more than anything else, the interaction between the community and the leaders and our fellows. And they've just done an amazing, tremendous job. I think we really need to applaud what they're doing. And I'm sure they're getting blessings from the people themselves and from many others who know what they do. And it's really challenging work. It's a really challenging work. And I think we have achieved so much more. Please, if you have any questions to ask them, they have a lot of personal stories, please ask them. It becomes easy for somebody like me to keep talking based on my language skills and narration and my understanding of that area.
Yeah,
forgive me for that.
Thank you so much. And we would like to open it up. We have about, well over 20 people, maybe close to 30 on Facebook and Zoom. And I know the summer months in the United States, things tend to lag a little bit, but we have some time now, and I want to open it up. There's some people that don't typically join us that are also on the Zoom call. There are a number of chats. Please just unmute yourself and join us. I just, I want to echo what Mahesh said. We were talking about this a little bit yesterday as a leadership team, how emotionally overwhelming the last year and a half has been for all of us. And it's truly been an inspiration, I think, for I know for me and for the board who met earlier today, and for many of the folks on the call, just to see the way that all of you who have shared have responded throughout this pandemic, and knowing how difficult it is, wishing that we could be there with you in some way, supporting you more directly and more personally, but really just being in awe of your commitment and the way that you live out the mission of this organization each and every day in your work of caring. I love that Mahesh uses the word caring rather than responding to the needs in the community. Lots of reflections on how proud, how honored, how just pleased Sammy and Jim Mayer would be as two of our founding couple. I really are one of our two founding couples. And of course, Sammy passed away tragically just a few years ago, but I know how moved her family continues to be by what's happening in India in particular. And I know from the Schultes how important it is for them to know that what Leah helped get started or to solidify in Nepal continues as well. Gratitude, Mahesh, for you for being such an asset and your leadership and knowledge and compassion in bringing this team together. Just lots of thank yous and acknowledgements of your incredible work on the Zoom feed. Anyone like to join in at this point? Anyone have any questions or additional comments, thoughts you'd like to share, particularly the board members that didn't have an opportunity to talk directly about the situation in South India during our meeting earlier? Abreen and Fumati, it's so good to see both of your faces. I wish we were there in person together.
Joe, I'd just like to echo real quickly what you said and what Mahesh said in terms of gratitude. I know as a staff member and colleague of these remarkable individuals, it's just truly amazing what they are doing. I mean, I know that I take so much for granted. I mean, the situation with the pandemic has been so horrific here, I know in our own country, but when you hear, you know, that you have to climb a tree, you know, to have a connection. And when you see these beautiful pictures, powerful pictures that we've seen not only today, but throughout, you know, this past year of the truly life-saving, as Clint said, and life-affirming difference that is being made, where, you know, folks are sharing what little they have so that others have, you know, a handful of grain or rice, you know, an egg or a sandwich, you know, at such tremendous personal sacrifice and risk for their own health. What a beautiful, beautiful message of love and solidarity that is, and how truly humbled and honored I am to be connected, you know, by our hearts through this work, through IPM, you know, 47 years ago in the making, how much it has continued to grow, you know, especially with the Fellows Program, how impactful that has been, just to continue to ripple out in terms of, you know, sharing that love and impact. And thank you all again, Mahesh, Hemit, Bindia, Parveen, Soni, Fumati. I mean, all of you are just a true inspiration. Thank you.
I hope it doesn't sound like the fact that not many of us have comments or questions that we don't think this is important. I speaking for myself, it's just, my head is just spinning, you know, I mean, because this is just so hard for us to comprehend. I mean, the pictures are worth 1,000 words, and your words are so eloquent, yet I just don't know how we can understand this. I mean, first of all, we barely, you know, we don't completely understand the situation you're in normal times. And now we have this pandemic, which is far from normal. And, you know, I mean, you've been telling us what's going on, and I just wonder if I really understand it. I'm not sure I can. You know, I thank you that you keep feeding us information and try and be educated. And I know a lot of other people are trying to stay informed, but this is just so hard for us to understand what you're going through. You know, we feel like we've been through something here, and I know it's nothing like, you know, we've been through nothing. You know, this is, my life was barely impacted over the last year, you know, in a big scheme of things. When you think about it, things changed, but I didn't suffer anything. And this is just so hard to understand. I mean, I don't understand how people can get up and go on every day. And it's just, I'm just amazed when I look at what you're doing and look at how people are surviving.
Jim, I want to thank you for giving voice to what I think most of us are feeling in the early days of the pandemic and the virtual forum. I would, as someone who thinks with their mouth open, as Mary Hellwig used to say, I always sort of wondered about the silence or the inability to find words to express what I was feeling. And I think you've given voice to what most of us have been feeling for much of the past year, the obvious disconnect between our reality and what's happening in India and Brazil and Nepal and so many other places right now. And I think it's this kind of connection, I think, as Carol said, just being able to see each other and be with each other, I hope in some ways is one small way we continue to support one another and express our solidarity and commitment to one another when we're not able to be together in person. And I know from my conversations with the members of the South Asia team that those feelings are shared. There's been a lot of heartbreak and a lot of emotion to our discussions over the course of the last 18 months, and a real desire to be in one another's presence and be able to embrace one another in person again. But doesn't seem like that's going to be likely anytime soon. So I think Mahesh, and sort of looking across the screen, I'm sorry if I'm not catching everyone's name, but I think Mahesh and Bindia, Parveen, Hemit, Soni, Fumadi, you all know how much you mean to us and how in awe we are of your work and how much we wish we could do more to support you each and every day. But I hope it doesn't sound condescending to say that you really continue to make us proud and continue to make your colleagues on the staff and certainly on the board and in the wider IPM family proud of what this little organization continues to be able to do in such difficult times. So, unless anybody else would like to add anything, we're at our time limit. We are evaluating and reevaluating sort of the efficacy and importance of continuing these forums through, in the US, what will be the summer months. It's quite difficult. I think all of you are aware some of the changes with Zoom and with Facebook is making it increasingly difficult to host these forums. But as Carol said, I think all of us are well aware of how important this has been for all of us to keep our spirits up and to continue our work together during this pandemic, and especially now in the midst of this second wave with so much death and suffering and not getting the attention, frankly, of the rest of the world the way it was when it was in New York or Detroit or our hometowns of Cleveland, St. Louis, and so many others. So we will be in touch about next week's program. We're hoping to be able to share more direct forums from our different project partners around the world, and also from some of the recent immersion experience participants to talk about their experience in both virtual and in-person immersions. And we'll be communicating with you the schedule for the upcoming weeks and months early next week. You can always find out more about IPM's activities and this programming in particular, and how you might support directly, as Mahesh suggested, the work of our South Asian team and colleagues on our website, on our Facebook page, or by reaching out directly to any one of us, particularly Ilsa and I here in the United States. So I want to thank you all again for this powerful and very moving and really incredibly impressive presentation. And I hope, Mahesh, you'll communicate to everyone there that, as Jim so rightly said, sometimes our loss for words is more of an expression of admiration and solidarity than anything we might say. So may the peace that passes all understanding be with you all this week and this weekend. And namaste, especially to everyone in South Asia.
Namaste, everyone.